Hey guys, welcome back. Today we will discuss about other psychiatric topic, that is somatoform disorder. Somatoform disorder is otherwise known as somatic symptom disorder, that is SSD, or psychomatic disorder. So these three things are same only: somatoform disorder or somatic symptom disorder or psychomatic disorder. So we will see what is this. Somatic disorder or somatoform disorder or psychosomatic disorder means it is a mental health condition characterized by occurrence of physical symptoms due to psychological distress. So the person or the patient will show physical symptoms. For example, they will complain headache, they will complain stomach pain, they will show paralysis, they will show vision loss, they will show blindness. But if we go for a medical examination, we don't find anything, or we'll not get a specific reason behind this condition. So that situation is known as psychosomatic disorder or somatoform disorder. So it is characterized by the occurrence of physical symptoms. Physical symptoms will be there in patient, but there won't be any physical reason, and it is because of psychological distress. The major symptoms of the somatoform disorders are pain, neurological problems, gastrointestinal problems, sexual dysfunctions, and usually the people with this somatoform disorder have anxiety disorder. So it is a condition characterized by the occurrence of physical symptoms, but there won't be any physical reason evident for physical reasons or medical reasons, and it is happening because of psychological stress. And what is the etiology of this condition means? Sorry guys, we don't know the exact etiology. The exact cause behind this condition is still unknown. But there are a lot of risk factors, as I said in previous conditions. In most of the psychiatric problems, we can see a lot of risk factors comparing to a proper etiology. So here the etiologies are very difficult to identify. Etiology means cause. So in this case also the same condition only, or the same situation only, we can see the exact cause of this condition is unknown. The risk factors include genetic and biological factors like sensitivity of pain. Too much sensitivity towards the pain might be a reason, but this is not the actual reason. This might be a reason, may or may not be. Then family problems and family history of any disease. Okay, in your family anyone is having some chronic illness and you are watching this thing from your childhood, means that anxiety will get automatically preoccupied in your mind, and that may lead to this psychosomatic disorder or somatoform disorder. Then family problem in the sense severe family problems, and you are the victim of that family problem every day, and you don't know how to show that problem out. You don't know how to explain or convey the problem out, means your body and mind will work together and will find out a solution and will come to a conclusion in the form of psychosomatic disorder. This is because of the relation between your mind and body. You know that very well, that what there is a strong relationship between our mind and body. Your mind and your body are the best friends. Okay, so you cannot see any friends like that. So when your body is having problem, your mind will get start to support your body, and when your mind is having problem, your body will start to support, and that is psychosomatic disorder. Then personality problems. Your personality or your behavior is having problem, means there are chances of this condition, but might be, or might be, may or may not be. We cannot specifically say this is the etiology or cause. Then depression. If you have depression, means sometime you cannot show the depression. How to show you have depression? In that stage you will show your depression in the form of pain, in the form of neurological problems, in the form of gastrointestinal problems, in the form of sexual dysfunction. Then having some medical condition, some severe medical condition, and followed by that medical condition there are chances of stress, psychological stress, and the psychological stress will occur in the form of psychosomatic disorder. Then stressful life events, substance abuse, trauma, violence, childhood sexual abuses, and having low level of education. Then socioeconomic status problems like poor socioeconomic status problem, and learned behavior to get attention and benefit. Okay, if you're watching or if you're observing something that someone is having pain and problem and fever, okay, they'll get some benefit, they are getting some attention from others, means to get the same attention from the loved one, you may act like that, especially childhood area of your life, especially in the childhood time only. These problems we will see. Learn behavior to get attention and benefit. Then anxiety. So these are all some risk factors related to the psychosomatic disorder, or SSD, or somatoform disorder. These are all the risk factors, not the exact etiology. Then, while coming to the types of somatoform disorder, first thing is persistent somatoform pain disorder. Persistent somatoform pain disorder, the patient will complain about severe, persistent, continuous pain without any medical reason. If we check, we don't find out the reason behind the pain, but the patient will complain that they have pain. That is known as persistent somatoform pain. The problem might be inside their mind. They couldn't show the problem. They couldn't tell that they have problem and distress in their mind. But the problem will arise. Problem will show in the form of pain. And it occurs in association with emotional conflict. Second type of somatoform disorder is dissociative and conversion disorder. Under dissociation and conversion disorder, a lot of disorders are there that we will discuss in future videos. Okay, so what is dissociation and conversion disorder? Means a partial or complete loss of the normal relationship or the connection between memories of the past and the bodily movement. You will lose the connection, your normal control or connection between your normal body control and your experiences. Sometimes you feel blindness, sometimes you will feel hearing loss, sometimes you will go to a paralyzed stage. Okay, sometimes you will lose your identity and you will go and wander in some other place with some other identity. So that is known as dissociation and conversion disorder. That is other type of somatoform disorder. Then illness anxiety disorder, and previously it was known as hypochondriasis. In this condition, the people mind is occupied, I mean it's preoccupied with concern that they have a serious disease. So always they have an anticipation or fear of something going to happen in their life. Their mind is preoccupied with some ideas. For example, like stomach pain means stomach cancer. Headache means brain tumor. That's it. Okay. Next thing is functional neurological symptoms disorder or conversion disorder. This condition is characterized by people have neurological symptoms that can be connected to a medical cause. For example, abnormal movement, seizures, blindness, loss of sensation or numbness. Next is other specific somatic symptom and related disorders. In this category, the somatic symptoms occur for at least 6 months, and specific conditions we can see like pseudocysis. That means the woman will feel that they are pregnant and they will show all the symptoms like a pregnant lady. So this type of symptoms and this type of problem will maximum exceed for 6 months. Then somatization disorder. Somatization disorder means nothing but the patient will show physical symptoms, but there is no physical condition present or there is no physical reason behind this. Then pain disorder. That means persistent, recurring pain in one or more part of your body, but there won't be any medical cause behind this pain. So here, one thing you just understand that you can see physical symptoms in your body without any physical reason, and the reason behind this physical problem is psychological distress. And while coming to the general symptoms and signs, I'll tell you some symptoms such as persistent abdominal pain, headache, joint pain, poor concentration, dizziness, continual worry over physical health, acts like acute flu-like illness, complete loss of bodily sensations, loss of disturbances of motor functions, and pseudo seizures. So these are all some general symptoms. Okay, so but pain is the major thing. Then while coming to the diagnostic procedures include history collection, physical examination, mental status examination, neurological examination, CT and MRI. Sometimes the doctor will directly go for CT and MRI if they are complaining about pain. But through the CT and MRI, they don't find anything, and gradually they will come to a conclusion, or they'll come to an idea that they don't have any physical problem, and they'll go for detailed mental status examination, neurological examination, and history collection, and at last they will come to the diagnostic evaluation that they have psychological distress and the somatoform disorder. Then we're coming to the management. There won't be any proper management, but therapy, psychotherapy, talk therapy, motivational therapies and teachings are the major type of therapies or treatments. And while coming to the family therapy is also playing a major role because the family only can understand them comparing to any other group. Then encouraging live self-monitoring of pain, then reinforcing the behaviors, developing healthy coping mechanism, techniques to shift the patient's focus from physical symptom to pleasant joint activities, liaison with school and social services, proper sleep hygienes, dietary advices, etc. Then apart from that, cognitive behavioral therapy we will use to change the maladaptive behavior of the patient to adaptive behavior, and at the same time it will help to understand what is the negative behavior they have or they're showing in front of others and how to cope up with the problems and concerns related to their physical and psychological aspects of their life. So this is about the treatment modality. There won't be no proper medication for this condition, but the patient is showing depression and depression symptom means definitely the doctor will write for antidepressive drugs, and anxiety means anti-anxiety drugs, but there is no licensed drug for this condition because there won't be any problem in their body. At the same time, there won't be any problem in the mind. So it is literally difficult to give a proper medication. So for psychological distress, always what is the treatment? Therapies, talk therapy, effective communication, psychological support, emotional support, and always positive vibe you have to give to the patient. That is the only thing we can give for the patient. That's it. Okay, so this is about psychosomatic disorder, somatoform disorder. Okay, among this dissociation and conversion or conversion dissociation disorders is little bit long one that we will discuss in the next video. Hope you understand, guys. Thank you.